before I pull
It's
it
too
up.
short.
Okay,
It
can
needs
I
to
have
be
somebody
raised.
help me please? Circulator, can you pull this down? So this has to be done before you put it over the patient, because if I pull up, that part is unsterile, I don't want it at a sterile level up here at my patient, okay? So you need to raise the Mayo stand and make sure it's not resting on your patient. So you need to put your hand underneath it, push it in, make sure it's not resting on your patient, okay? One of you guys that has a gown on, come up here and be my surgeon, please. Go ahead, so whoever you draped with. Over here. Please, somebody, anybody? Okay. Obviously you would have gloves on, okay? So hand your light handles to your surgeon, then you're gonna hook up your cautery. So the cautery is going to go on the drapes to the patient's dominant hand on their side. So Kim, you're right-handed, right? Okay. So I wanna hook this to the drapes to her dominant hand so that she can use it throughout the case. So she's gonna stand right across from the incision, right about here. So I'm gonna have this positioned here, and I wanna make sure that the towel clip is down, not sticking up in the air like this, okay? And you wanna have it on the outside edge from where she's gonna stand and work, because if I have it over here, it's gonna get in the way. So have it on the outside edge from where she's gonna work. Check, make sure your pencil's long enough, it should be. Then you need to look and see where your cautery machine is. Mine happens to be over here. Hook it to the drapes before you toss the cord off, because if you toss the cord off first, you're likely to be pulling something that's unsterile back up onto the field, okay? And then toss your cord off, it'll get plugged in by your circulating nurse. Make sure you don't drop your hand down here when you're tossing your cord off. Your suction can go either above or below the incision. It really doesn't make any difference. Okay. Again, check and make sure you have enough length, and you should. Now, there's two ways you can hook this to the drapes. You either take the drape and wrap it up around and then clamp the drape. Okay, make sure you don't clamp the tubing. Or some of these drapes have these little flaps like this. You can take and wrap the flap around and then clamp the bottom of the flap. Okay, again, try to make sure that your towel clip is down and not sticking up in the air. Again, I want to look and see where my suction tree is. I think it happens to be on that side over there. Toss it off on that side. Okay, and then the circulating nurse will hook it to the machine. You're going to take your dry laps and place them on either side of the incision. Got 3 up here, so we only want 2. Okay, and they should be regulars.
I said those look small like that.
Yeah.
Those are bad shot.
Okay, then you're going to bring your back table up. Extra stuff. Bring your back table up, push your foot in the bed, okay?